Hello, my name is Clare McNamara, and I am one of the speech-language pathologists here at New Braunfels Regional Rehabilitation Hospital. In the spirit of Better Speech and Hearing Month, we thought we'd share with you a little bit about what we do every day. One aspect of our job is helping those who have lost their ability to communicate, maybe through a stroke or another brain injury. One big diagnosis that we see is aphasia, which is most commonly caused by stroke. This is a language disorder that impacts somebody's ability to understand what's being said to them and also to express themselves. Another impairment is dysarthria, which is a speech disturbance also caused by stroke that can vary in severity. It can be mild to a little bit more severe with some mumbled or slurred speech, which can also impact communication. So those are just two challenges that our patients may face, and a little bit about communication. So Janet is now going to fill you guys in on the cognitive aspect of our job.
Yeah, my name is Janet Spradley. I'm also a full-time speech-language pathologist here at New Braunfels Regional. And like Claire said, in addition to communication or speech production disturbances, we work with individuals with cognitive challenges, which refers to an individual's ability to use the thought processes needed to get through their daily activities. That could be anything from orientation, awareness of where they are, why they're here, what the date and time is, memory, remembering short-term information to more long-term functional information. It might be problem solving. That's one that we deal with a lot with our individuals. How is their safety awareness to get through their daily tasks? Are they able to sequence the steps needed to complete from very basic to more complex daily needs? We also will target attention oftentimes. Does an individual is unable to complete a task thoroughly without being cued back to whatever the activity might be. And then that covers the main ones, the main cognitive areas. Of course, that can affect individuals with strokes, brain injury, other neurodegenerative diseases. And so yeah, those are the two domains that we wanted to share with you today.
Hi, I'm Lindsay. I'm one of the full-time speech-language pathologists here at the hospital, and I'm going to tell you a little bit about dysphagia. Dysphagia is a medical term for swallowing disorder involving a person's ability to protect their airway. The biggest thing that we're concerned with dysphagia is the accumulation of food and liquid into a person's lungs, which results in aspiration pneumonia, obviously complicating their recovery. Dysphagia can be diagnosed through a variety of ways, at bedside, through a modified barium swallow study, and there are also other methods to evaluate it. We typically treat it with manual exercises. Electrical stimulation could be a method that is frequently used as well, or in other cases maybe diet modifications, such as grounding meats, pureeing foods, thickening liquids to different consistencies, depending on that individual's where their breakdown is in the swallow function. So those are just some main points about dysphagia. Along with cognition and communication, those are just a few things that we deal with daily for speech therapy. Thank you for watching.